The whole nation was suddenly watching Kentucky last year when we fired up our new health benefit exchange and promptly began bringing health care coverage to people who desperately needed it. The success of Kynect, Kentucky's health care connection, proved two things to the nation. One, short term, despite the problems faced at the federal level, a health benefit exchange could actually work. And two, long term, federal health care reform was going to bring positive transformational change to both individuals and states. As a result of Kynect, today more than 500,000 Kentuckians are on a trajectory toward better health and increased financial stability, and many say they have hope for the first time in their lives. For the Commonwealth as a whole, Kynect is helping us attack and hopefully one day overcome a fundamental weakness that has held Kentucky back for generations: the poor health of our people. This Saturday, we begin the second round of open enrollment for Kynect. And while the first enrollment made Kentucky the envy of the nation, we're not satisfied. We know we can do even better. So we've made numerous improvements in the Kynect experiences, changes that will make shopping for insurance easier and that will encourage more people to sign up. I want to talk about some of those today and give those people on both sides of the sign-up process a sense of what to expect. My message is aimed at both those who are new to Kynect and need to sign up for the first time, and those who signed up last year and need to re-enroll. Kentucky will have a passive enrollment, which means if you enrolled last year or earlier this year and want to keep your same insurer, you don't have to apply again. But it would be a mistake not to take another look. If you do nothing, you will miss out on possibly finding a better plan, because increased competition has widened the options. You see, critics of the Affordable Care Act predicted that companies would flee the program after the first year. Well, in Kentucky, just the opposite happened. This year, we have additional insurers and additional plans. And the plans offered by the existing insurers changed as well. So there's a lot of choice. So just like last year, we encourage people to aggressively shop for the best product and rates, even if they've already signed up for a plan. Now, many of the costs have changed as well. Some premiums have gone up, some have gone down, and some have stayed the same. The same is true for out-of-pocket cost and for subsidies, which are based on fluctuating income. Again this year, we expect more than 3 in 4 consumers to qualify for payment assistance of some kind. I've been asked whether there is an average price or whether there's an average increase or decrease for the plan's cost. There isn't. Any number I would give would be meaningless to individual consumers, because a lot of factors go into figuring out their cost. I'm talking about variables like the type of plan, where people live, whether they smoke, how old they are, their family size, and their household income. In fact, when you throw those variables into the mix, there are some 70,000 different rate scenarios for qualified health plans offered on Kynect. And you also have to remember that insurance premiums, even before Kynect, were going up an average of 8% or more a year. In addition, there were no subsidies available to individuals to help reduce their premium cost. Now, we have a few representative scenarios to illustrate the impact a subsidy or discount can have on a health care plan. And you've got to put the first one up. This first one is a 22-year-old college student earning $18,000 a year. As you can see, he'll get a subsidy of $104 per month, so his cost will be as little as $20 per month. The next one. A single parent, a single mom with 2 children earning $35,000 qualifies for a $240 subsidy, and she could get a plan for just $93 per month. The next one illustrates a family of 4 earning $65,000 per year. They could get a $249 monthly subsidy. The lowest cost plan available would cost them about $336 per month. An older couple with no dependents earning $50,000 could get a subsidy of $526 per month, lowering their out-of-pocket costs to $160 per month for a health plan. We've put a copy of these charts also in your media packets. The bottom line, as I said last year, is that you need to go to Kynect, plug in your information with help if you need it, and find out what it can do for you. Now, for Kentuckians who enrolled in Medicaid, there is no need to go back to Kynect unless your household income changed or you want to use a different managed care organization. Now, for those seeking private qualified health plans, what else is new this year? And we've got all that up there. Good job, Carrie. Number 1, we've developed a free mobile app for use on Android and Apple devices. The app will allow consumers to figure out what plan they're eligible for, as well as get an estimate of their subsidy. They will also be able to find insurance agents or connectors or upcoming enrollment events in their home county. Versions of the app available later this year may allow users to upload income verification information. Number 2, we have improved the front page of the website to allow consumers to find out the amount of their subsidy without actually applying. Number 3, we've increased from 185 to 400 the number of Kynect call center representatives, and call center hours have been expanded. This will decrease waiting times and speed the application process. Number 4, we have doubled the number of insurance agents selling insurance plans. That has gone from 1,400 agents during the last sign-up period to 2,800 agents. Agents signed up 44% of Kentuckians who bought private health insurance through Kynect last year. They make the process a whole lot easier. Number 5, we'll be opening a temporary store in Lexington dedicated to Kynect, not just marketing, but also providing full service. And number 6, we have developed a new reader-friendly How to Kynect brochure. We believe these changes will make Kynect even more effective. Earlier this year, President Obama, in his State of the Union address, praised Kentucky and called me a man possessed when it came to finding health care coverage for Kentuckians. Well, it's true that I am dedicated to this issue, but the credit for Kentucky's successes belongs to people like Secretary Audrey Tays Haynes, Carrie Banahan, D.J. Wasson, Sharon Clark, Larry Kistner, and the many thousands of connectors and others who have worked behind the scenes. We enrolled more than 521,000 Kentuckians into health care coverage during the first year. 3 out of every 4 of those people said that they did not have health insurance at the time. A Gallup poll this summer reported that Kentucky's drop in uninsured was second highest in the country, going from 20% in 2013 to just under 12% midway through this year. I hear from people every week about how Kynect has given them better help, and real hope for the first time in their lives. They cite specific health concerns that are being addressed for the very first time. Now, critics of healthcare reform make those people out to be aliens from some distant planet. But you and I know they're not. They're our friends. They're our neighbors. They're our family. They're farmers. They're construction workers. They're substitute teachers, nurses' aides, dental and medical students, social workers, new graduates working at a high-tech startup, and many part-time workers. Now, in addition, the greater demand for health care is helping the industry grow. From July 2013 to July 2014, we've seen an additional 3,000 jobs in core healthcare services in Kentucky, and almost 8,000 additional jobs in administrative and support services. Almost top to bottom, all areas of healthcare spending have dramatically increased, including for rural hospitals. From state fiscal year 2013 to fiscal year 2014 alone, total spending increased 13%, from $5.5 billion to $6.2 billion. Hospital spending alone increased 20%. As a result of Medicaid expansion, distribution of payments have unequivocally increased for hospitals in both rural and urban areas, with few exceptions. As for indigent care, the decreasing number of uninsured patients has led to a commensurate decrease in the potential cost of uncompensated care. Of course, the financial impact of health reform is only part of the benefit. The biggest advantage is in better health outcomes, and we're already seeing some evidence of that. Looking at health outcomes in the Medicaid population, just since January of this year, adult preventive services, such as well visits and flu shots, have increased almost 37% over 2013 rates. Breast cancer screenings are up 20% over last year's numbers. Colorectal cancer screenings have increased almost 17%. Adult dental visits are up by more than a third. Those are significant improvements, and we expect those trends to continue. Now, we plan to use this improved access to health care to make meaningful progress on improving Kentucky's status. Kentucky Health Now focuses on 7 specific goals over the next 5 years, representing the issues or behaviors that most contribute to our dismal health rankings. Kentucky Health Now sets out specific strategies to reach goals like cutting our smoking rate, our obesity rate, reducing deaths caused by cancer and cardiovascular disease, improving our oral health, and reducing deaths from drug overdose. This will not only save lives, but also make Kentucky more attractive to businesses looking to come here to hire our workforce. So yes, healthcare reform will pay for itself many times over. That's why what we're doing with healthcare access and with kynect is absolutely critical to the future of the Commonwealth of Kentucky. So here's to another successful enrollment period. Thank you very much. Okay. Thank you. Questions? Yeah.
Governor, if you, we added 521,000 Kentuckians in coverage roughly a year ago. Do you have a goal for a year from now, how many additional Kentuckians you want to see covered by the time you leave office?
We've set no numerical goals. Quite honestly, I'd love to see every Kentuckian have coverage by the time I leave office. We probably won't get there, but we're going to be closer to it come the end of this enrollment period than we were at the end of the last enrollment period. I expect to sign up several thousand more people.
Governor, the Democrats, of course, were able to retain control, their majority in the House. I don't think they lost any seats or
Yeah, I'm glad you changed from hanging on. We actually
The
did
margin didn't- the
very
margin-
well.
The margin didn't change.
Yeah.
There might have been some shuffling. Did you view that as an endorsement of Connect or an affirmation from from voters and their support of Connect?
I believe we were successful in maintaining the majority in the House of Representatives because the priorities that I've had for the last 7 years and that the House Democratic Caucus have had for the last 7 years are the same priorities that Kentuckians have. The number one priority is jobs, and we have made creating jobs, retaining jobs, getting our people back to work the highest single priority that we have. And the second priority is lack of gridlock. I think Kentuckians, from the very time that I ran for office, responded to our approach of working with both sides of the aisle and trying to bring together to make things happen for Kentucky. I campaigned on the idea that I didn't care whether it was a Democratic idea or a Republican idea. If it was a good idea, then we ought to all sit down and work toward implementing it. That's the way that we have worked for 7 years, both myself and the Democratic Caucus, and I think that appeals to most Kentuckians. They want folks that will work on both sides of the aisle. That's what we've done, and I believe those two things are the main reasons that we maintain that majority.
Governor, there were changes, of course, in Congress and the federal level. Are you concerned that pieces of the Affordable Care Act may start going away as time goes on?
I think it's clear from comments from both sides that the Affordable Care Act is not going to be repealed. If for no other reason than there is not enough votes in Congress to override a presidential veto, and President Obama is certainly going to veto any bill that would simply repeal the Affordable Care Act. There is some conversation about working on various parts of it and compromising on various parts of it. I'm sure that the president is open to doing some of that. Hopefully Congress is open to doing some of that. But I don't see the Affordable Care Act going away, and I'm going to leave the changes to those folks in Washington, and we're just going to hit the ground running again this year and get as many Kentuckians enrolled in affordable health care as possible, because long term, it is the best possible thing that can happen to Kentuckians.
Governor, a lot of legislators in Kentucky are concerned about the additional costs of expanded Medicaid. What will those costs be additional to the general fund the first year that Kentucky has to begin picking up part of the cost of the expanded population?
As you know, we did an economic study before I made the decision last year to expand Medicaid, and we asked outside groups to do it for us. We had PricewaterhouseCoopers and the Urban Institute at the University of Louisville do that study. They came back to me and said, Governor, you really can't afford not to expand Medicaid, because over the next 8 years, it's going to infuse about $15.2 billion into your economy. It's going to create about 17,000 new jobs and would have a positive impact on your budget. So on that basis, as well as knowing that it was morally the right thing to do, I made the decision and we moved ahead with the expansion of Medicaid. Now that we are coming up on the end of a year's worth of data, we're going to ask outside sources to again take a look at this and to evaluate where we are. I'm not going to anticipate the results, but I've mentioned a few of the indicators here that I think are very positive. Number one, we've seen an increase in the number of jobs in the healthcare sector by 3,000 already directly in the sector, and 8,000 in the administrative and support sectors for the healthcare industry. So it seems that those jobs are increasing just like that initial report said they would. Obviously, the money is being infused into the economy, and that comes by way of the 100% contribution of the federal government up until 2017 in expanded Medicaid, as well as all of the subsidies that we're getting that are flowing through our economy with the qualified health plans. So I'm looking forward to seeing the next economic study to find out where we are on that on that continuum to see how this is developing.
And it'll-
I was confident after that initial report that we could certainly afford down the road over the next 8 years to expand Medicaid and stay within our budget. I'm still confident of that at this point, but obviously we'll take a look and see if there's anything there that causes us any concern. The point that some folks keep missing is the fact that if we hit some kind of catastrophic wall, the law allows us to back up on expanded Medicaid. Now, that's the last thing I want to see happen, and I don't think it will happen, but there's a lot of flexibility there.
Governor, the expanded, or the number of jobs added, is that net jobs? Because I know in Louisville, for example, there have been some layoffs in the healthcare industry.
These are numbers out of the federal labor statistics. So you'd have to go and take a look at that. But, in every industry, you're going to have some jobs going away and other jobs coming on. So you can go and look at that and figure that out. But all I know is they're telling us that we have created that many more healthcare jobs and that many more administrative positions in connection with the healthcare industry.
I'm sorry. The improvements you made, the website, the app, the numbers of people, how much does that cost? Where is that money coming from?
It's all federally funded. We're still utilizing federal funds.
Yeah. All the changes are federally funded.
Is Connect still on track to be self-sufficient this year, self-sustaining, or next year, I guess, 2015?
Yes, we are.
Yes.
And Governor, this new consultants work, when will that begin?
It's beginning at the end of this year, isn't it?
End of this year or early next year. We want to accumulate as much data as we can. We'd like to have a full year's worth.
It'll look at the big picture like the first one did, but also with a particular look at what the dollar amount added general fund cost would be estimated to be for the state budget due to expansion.
It'll take into account all the people we've signed up.
That's correct.
And take all the statistical data that we have.
The storefront that you added in Fayette County, why Fayette, why not Jefferson, other places?
So the Fayette County area and the surrounding counties was an area that we wanted to target. Enrollment numbers, were a little lower than some of our other counties, so we wanted to focus on that particular area.
Governor, what makes you so confident that the state is going to be able to have enough money to pay for the Medicaid expansion? And we just finished the two-year budget cycle, or the last budget year that had a shortfall close to $100 million. And what makes you so confident that the state's going to be able to absorb all this?
I'm confident because we had internationally renowned PricewaterhouseCoopers, as well as the Urban Institute at the University of Louisville, come together and give us an independent analysis of this. And on that basis, we made the decision. And since that time, we have indications, just like the employment numbers, that things seem to be tracking along the lines of that study. But as you know, the study assumed that we would have somewhat less in terms of people signing up than we actually did. We were successful beyond our wildest dreams, and we're very happy about that, obviously, because the more Kentuckians that sign up, the better long-term Kentucky is going to be. But all of that will now have to be taken into consideration as we look down the road. In the end, this is always about priorities. It's always about priorities. Is the health care of our people one of our top priorities? It is mine, and it is this administration. And I would hope that that the next administration, whoever that might be, and the next legislature will have the same kind of priorities.
I don't understand the examples you used of individuals, and you would say that lowering his monthly cost, like the student, to $20, from what? How much has it been?
Yeah, well,
Yeah,
yeah,
that's-
you want to get the example?
Yeah, we can get that back up. There he is.
Is Robin here?
No.
Robin's not here, okay.
Well, what you could do
Yeah,
is take $20 a month,
Okay,
that's gonna be out of his pocket,
yes, sir.
and 104, that's gonna be the subsidy. Add those together, and that would have been his premium.
Okay.
So
$24 would have been the premium, yes.
Would have been his premium, and he's gonna get 104 of that 124 as a subsidy, so he's out of pocket $20 a month. And that's the same as all the rest of them. You could basically go through that exercise.
And to Lawrence's question, when you asked how much these improvements, you said federal funds, but you didn't give a dollar amount.
You know, we can get that figure for you, but, you know, we're making several system enhancements, and those particular enhancements to the self-service portal will get you that dollar amount. I'll get it to Carrie.
What was the first, you'll have to forgive me, what was the first fiscal year Kentucky will have to pick up part of the cost for Medicaid?
2017 calendar.
Calendar, well, I mean,
6 months of 2017.
right, so beginning January 1st of 2015, we have to start paying for part of the exchange costs, so.
The exchange
The
cost.
exchange.
He's
you
talking
talking
about
about
expanded
Medicaid?
Medicaid.
Oh, I'm
It's
sorry,
2017.
17.
2017.
2017.
Do you have any estimate right now, best guess, educated guess of what that additional cost will be?
No, but we're gonna know, as soon as we get this study back. We'll know better.
You said you can't compare rates, but I guess the average, if there's a person, an average Joe out there, say 55-year-old, he got Connect this year, and he's got emphysema, will his costs increase?
Well, Jack, number one, as we mentioned, there are so many variables that he would plug in before he can find what his rate would be, that we can't give you just a off the top of the head guess. But something that you said is very important. He's got emphysema. Before the Affordable Care Act, he would either have to pay an exorbitant amount of money for health care insurance or not even be able to get it. Now, that pre-existing condition doesn't matter. He can go in and he'll be able to get it at the same rate as somebody his age with all of his factors that didn't have emphysema. Am I right?
Correct.
Yeah.
And when he enrolls, he'll know exactly how much he might have to pay.
He doesn't even have to enroll. He can look at the screen now. That's an enhancement that was made. And he can put his estimated revenue and look at various choices of plans. It will provide him with any tax credit or federal subsidy that he might get. And so he would know that before he even has to enroll this year.
Will he be notified if he doesn't look? He needs to do that himself, look at the computer.
He can,
Yeah, he can call our contact center, they'll take him through the process. He can contact an agent or connector, or he can go to our local DCBS office.
Governor, it's been a year, but my guess is there's still tens of thousands of folks who should have signed up, obviously, who haven't. Well, what's your message to, I would assume, maybe just some young people who are probably pretty healthy and rolling along, and assuming they can get by without insurance, or just sort of block it out of their mind and go on with their lives? What's your message to those folks at this point who are still uninsured?
As you say, there are thousands of Kentuckians still uninsured, and they're uninsured for a lot of different reasons. Some are in sort of the young, invincible stage where they simply don't think they need it. I'm hopeful that as we advertise more and get the message out of how important this is and how little it'll cost you, that they will see the need for it before they hit something catastrophic that will wipe them out financially. There are others out there who don't want to do this because it has something to do with President Obama. And my message to them is the same message I had last year. Look, you don't have to like the president. You don't even have to like me, because it's not about him. It's not about me. It's about you. It's about your family. It's about your kids. So, just do me a favor. Either go online or go to an insurance agent, call the hotline, and just see what you might be entitled to. See what you might be able to get. I can guarantee you you're going to like what you find.
Are we gonna get calls, reporters, we always get calls to connect that somebody said the rates have gone up tremendously under this? Do you expect that's gonna happen?
There's no telling what may happen. I mean, you're going to get all kinds of calls. Some people's rates will go up, some will go down, some will stay the same. That's why we're encouraging everybody to go shop again. Because, each year, these companies are going to file new rates. And, the plan that you had last year, the cost of that may go up some, or it may go down some. But if it goes up, go back online, call up your insurance agent or your connector, and take another look. Because we actually have 2 more companies than we had last year, so we've got even more competition. So, people will be able to find a plan not only that they can afford, but will be satisfactory to them. Okay, thank you.
Can we ask the governor about the budget? Are we gonna have a budget shortfall, or what, we're supposed to get some kind of, October receipts soon?
When are we putting that out? Today?
Yes, sir.
Okay, well, after we get that out. The first quarter's revenues have not grown as projected, which is a cause for concern. But October's revenues were very encouraging. That's the first month of the next quarter. And so, there's no reason at this point to panic. We're just going to be carefully monitoring the situation.
Thank you.
Why was the quarterly report due October 30th not released yet?
Is that the one coming out today?
Yeah.
Because it just was finished.
Why was it late this time that it never, before, it was late at least in my experience?
They just weren't finished with it.
No hidden agenda. They just got through with it. Okay, thank you. Thank you.
Thank you.